How is bile acid malabsorption treated? If you are wondering how to treat bile acid malabsorption, you are not alone. This condition can lead to uncomfortable symptoms like diarrhea and urgency. It often affects people with sensitive stomachs, including those with irritable bowel syndrome and colitis. Let's break down the treatment options available. Bile acids are substances produced by the liver and stored in the gallbladder. They help digest fats and absorb fat-soluble vitamins. When the body cannot absorb these bile acids properly, it can irritate the colon, leading to watery stools and a sense of urgency. One of the first steps in managing bile acid malabsorption is making dietary changes. A low-fat diet can be beneficial. Reducing fat intake helps decrease the production of bile acids, which may ease symptoms. This approach is especially helpful for individuals with sensitive stomachs, as it can manage symptoms without worsening digestive issues. Medications also play a key role in treatment. Bile acid binders or sequestrants are commonly used. These medications bind to bile acids in the intestine, preventing them from causing irritation. Some popular bile acid binders include cholestyramine, cholestyramine, and colesevelam. While effective, some people may experience gastrointestinal side effects, so it is important to monitor how you feel. For those with bile acid malabsorption linked to conditions like Crohn's disease or microscopic colitis, addressing the underlying issue is essential. However, many cases of bile acid malabsorption do not have a clear cause, making bile acid binders the primary treatment option. If you have a sensitive stomach, starting with a low dose of bile acid binders can be a good strategy. Gradually increasing the dose as tolerated can help minimize side effects. Combining medication with dietary changes often leads to better symptom management. It is also important to note that bile acid malabsorption can be underdiagnosed. It is sometimes confused with other conditions like irritable bowel syndrome or functional diarrhea. Accurate diagnosis through stool tests is vital for determining the right treatment. For individuals with irritable bowel syndrome or colitis, working closely with healthcare providers can help find the right balance in managing bile acid malabsorption, alongside other digestive issues. In summary, treating bile acid malabsorption typically involves dietary adjustments and medications, with careful consideration for those with sensitive stomachs and conditions like irritable bowel syndrome and colitis.